back to Dr. Brinda about this diabetes with PCOS is nowadays affecting during the pregnancy. So, what are your thoughts on that?
I think a lot of people have given insight into this. Part of this, all of this treatment is weight loss. If you are contemplating to be pregnant, you have diagnosed PCOD, and or you have been diagnosed with diabetes as well. Um, I tell my patients, try weight loss, weight loss, weight loss. So, of course, Ms. Gayatri and Ms. Alekhya have told us how to, work on that part. But essentially, we talk about reversal of metabolic derangements. You talk about improvement in blood sugar, cholesterol, blood pressure. You talk about improvement in ovulation indices, that gynecologists talk about. So, there's so many things. So if we can work on this process of losing weight, and as Dr. Seema mentioned, I tell patients, you don't have to put yourself into this fix that, oh, I have to lose like 40 kilos of my weight. Even minimum 5 to 7%. Studies have shown that even if you lose like somewhere in between 5 to 10% of your current body weight, it improves all these parameters. So the chances of getting pregnant, improving your chances of developing full-blown diabetes if you have glucose intolerance. So first step is, of course, emphasis on weight. The second thing is, of course, not everybody is equal. Not everybody responds as well to the lifestyle intervention. So don't lose heart. Of course, that's the most important thing. Keep in touch. Keep talking to your physician. So then we go ahead to the second line thing, which we say, medicine use, pharmacotherapy. So metformin is the hero. We talk about it all the time. Metformin does this, metformin does that. Metformin is the drug. Helps improve insulin sensitivity. Helps. There are certain studies which say that it even improves ovulation. Metformin is the drug of choice. And then, of course, there is some talk about there's a new drug which molecule is called liraglutide. So liraglutide is actually in the West, in the US and all, it's actually approved for obesity management over the BMI cutoff of 30. So it's not been, of course, it's a recent molecule, not so much studied in PCOD patients, but it's an option. It's an option. Liraglutide in a lower dose is actually approved for treatment of type 2 diabetes as well. So somewhere in the middle, we see that, if patients are improving, well and good. I'll just make a quick mention that, of course, if we are only talking about obesity and you are trying to improve the metabolic parameters, bariatric surgery is sometimes talked about, but that's a totally different ballgame. But suppose, of course, we're moving on with treatment. A person does conceive, is now pregnant, but the pregnancy is complicated by glucose intolerance or full-blown type 2 diabetes. So during pregnancy, sometimes in PCOD especially, may continue metformin because emerging data says metformin is safe during pregnancy in terms of outcomes for mother and baby. The drug of choice for treatment is insulin. We've had patients, come in with full-blown diabetes or bad numbers. If they had been taking metformin, are doing well, I may just continue it. But if the numbers are more than where I find it acceptable, then I reach towards insulin. Individualized treatment plans. There are patients who may need 1 injection a day, 2 injections a day, but essentially insulin is considered to be safe for the most part when you're talking about pharmacotherapy and the medications that we have available for treatment of type 2 diabetes. So the treatment of choice rests with insulin.
Recommending gluten-free diet nowadays. So, is it recommended during PCOS?
Basically, we need to understand that this concept evolved from the Western culture, right? So, gluten is nothing but it's a protein. It's a combination of two proteins, glutenin and gliadin. Okay, so when it mixes with water, it forms a kind of a sticky glue like consistency. So we don't need to actually kind of ignore it until and unless we have some conditions, like an autoimmune disorder like celiac disease, or some sensitivity with the small intestine and all that stuff. Because it is basically, we need to have, as I told you, especially in a PCOS, they need to have more of carbs which are high in complex carbs. Avoid simple carbs and take more complex carbs with a good amount of protein of high biological value. So if you take specifically for a PCOS, yes, we don't need to actually exclude it from our diet until unless we have some other kind of a disorder like celiac disease or irritable bowel syndrome or anything. So we can, it is safe for a PCOS. We'll go ahead. And again, debates, going on really whether, and researches whether it is real. Still, again, it is 50-50. So it is all like, as Dr. Archana rightly mentioned, each individual is different. And how their body works is also so unique from person to person. So it is not, we cannot generalize that, yes, a gluten-free diet would help, for this everybody. So it has to be personalized and tailor-made is my idea or thought.
Yeah, so yeah, we heard about gluten diet. The second thing is there is a lot of praise about keto diet nowadays. So what do you recommend routinely for the PCOS patient? And what is keto diet?
See, we all know now this is the trend that is going on among youngsters. Keto diet everywhere we hear, and even get ready tailor-made packs through Amazon. Everything is going on. But yes, we need to follow this under strict dietary guidelines. Because again, it depends on the age factor. Everything. Your stress levels. We need to, before you start on a keto, we need to check on the parameters like your blood pressure, your blood sugar levels, your creatinine levels, your uric acid levels. We need to take all these factors into consideration, and especially our lipids, because we know, as Dr. Vrinda was, mentioning more, on the insulin, how to increase insulin efficiency is our concern mainly for a PCOS. So again, the lipid profile is also erratic in a PCOS. So in a keto diet, it's nothing but it's loaded with fat, right? And there's very minimal amount of carbs going on, fairly amount, say around 20 to 25 grams of carbs is what it goes inside the diet. And we are also lacking in dietary fiber. And also, this is not sustainable in the long term. Once they, and, they either tend to overeat or, they don't follow it in the right method, then there is no much effect. Then they come back saying, we have followed it, but we don't find much difference. All these things goes on. So, we have to be very careful and judicious in what we go ahead with our plan, like,
But do you recommend for PCOS patients?
PCOS, no, as I told you, I would tell you that balanced diet is the best, with loaded with good amount of dietary fiber and rich in omega-3 fatty acids and complex carbs.
Thank you.
Welcome.
Miss Aleka, I just would like to know how much exercise they should engage in on the daily and a weekly basis to lose weight. So what is your suggestion on that?
So we just design an exercise program in such a way that they should exercise for 150 minutes per week, and out of which 90 minutes should be their high intensity aerobic exercise. So that is, we have to plan in such a way that there should be 30 minutes of exercise per day and for 5 days a week, out of which 2 sessions are to be strength training. And definitely we need to plan these exercise programs according to the individual condition. So for some patients, we need to include their high intensity interval training, or if they are like too weight and they are planning for pregnancy, we can add their core strengthening. So according to the individual condition, we design an exercise program, and how much they have to start with, how to increase gradually. And we need to set some realistic goals while starting these exercises. So according to the patient's condition, we just tell them, we design a program and how to gradually increase them.
Okay, yeah. Thank you. Archana, could you tell that hair growth is like really an embarrassing concern for PCOS patient, and they face in a day-to-day situation. What is the best way to get rid of this such hair growth?
Yeah, Sharmi. So regarding the hair growth, these women tend to usually go for there are two different kinds of treatment, like temporary kind of treatment, like for waxing or bleaching for the hair growth, and for the permanent, they might go to a cosmetologist or a dermatologist, like for electrolysis treatments or laser. But as we have been saying that these are due to the hormonal changes, they should come to the gynecologist before they get treated with the lasers or electrolysis, so that the efficiency of the lasers or the electrolysis would be much far better than what they have been taking it directly without taking the anti-androgen treatment. I mean the medications, so that if we are treated for at least a period of 6 to 8 months with the anti-androgens prior to taking these treatments, that would help in slowing down the process of hair growth and reducing the further growth of new hair, and they would make the hair finer in texture, and that would help the lasers and electrolysis or any other permanent techniques of hair removal or whatever instant techniques to be much more efficient. So these are the medications which we usually would prescribe. So they should at least use them for a period of 6 to 9 months when they plan to go for lasers and electrolysis or any other permanent techniques for hair removal. As every one of us have been saying, the main funda for PCOS would be to lose weight, maintain lifestyle modifications, maintain little diet, and though there is no cure for PCOS, the symptoms can always be reversed and they can be kept in check.
Here I would like to ask Ms. Kirti that we have women who are not able to conceive due to PCOS, but our society expects them to get pregnant as soon as they are married or as soon as they should give a birth to a child. So that will lead to a lot of familial disharmony, divorces, and other psychological issues amongst the women. What is the best way to deal with that? What's your suggestion on that? How they can lead a better life? Yes, please.
Yeah, this is very important question, which is very important to address. Basically,
हेलो
PCOS can
मैं तो
be
मेरा कैमरा कहाँ गया
yeah, PCOS can be very devastating to women, especially during the reproductive years. So here it's very important that when a woman is going through this kind of a thing, it's very important that the entire family has to be counseled along with her. This is very, very important because the family and the partner of the patient should be definitely counseled on the points like, PCOS is definitely not a fatal nor inherently dangerous disease, basically. And vast majority of women with this kind of condition do fine basically otherwise. So it's important to know that she can live a full healthy life, even having a PCOS, which if managed well. So and then like other doctors suggested that making a very good decent lifestyle changes, and then is very important. But then these lifestyle changes have to be done along with the family members, instead of singling her out, basically. And the family has to be very supportive and understanding if she's struggling through any of these kind of depression symptoms, or self-esteem or mood swings or whatever it might be, because we know that PCOS and depression definitely go hand in hand. And seeing a very good counselor or therapist along with the family is very, very important, for the patient or for the girl or whoever is going through that to come out of this, and along with the entire family. And one more important thing should be like, an early diagnosis is very important now, so that, this will help, the long-term management of PCOS, and also women can still live a very healthy and active life, and avoid long-term complications as such.